In this section on medical care, we will discuss the following: medical religious values, hygiene, women's health, specifically gynecology and obstetrics, psychiatry, and finally, transfusions and transplants. First, we're going to emphasize what we call the golden rule. It's simple and it goes a long way. The golden rule is show sensitivity for your patient's faith. When you, as a healthcare worker, take the time to let your patient know that you're giving them optimal medical attention while at the same time being sensitive to their faith considerations, that shows cultural competence. That shows empathy and emotional intelligence, and it shows that you care. At a basic level, this can be done by asking your patient, is there anything that I need to know about your faith related to your healthcare? Moving along, let's talk a little about medical religious values. There are so many, but we'll highlight three commonly referenced concepts in Islam that speak to overarching medical values. First, we have the teaching that stems from the Quran, which states that saving one soul is like saving all of humanity. Quite clearly, this emphasized the value of life and the importance of doing all that's within one's power to save a human life. The second point is medical necessity overrides religious prohibition. Basically, this value is saying that even though there are strict prohibitions set place in Islam, those prohibitions are eased and even removed in the face of medical necessity. This is particularly important because religious teachings can influence medical decisions, and so understanding religious lenience in times of medical emergency is critical. The final religious value we'll cover is really a combination of the two previous points, and that is that in life-threatening situations, saving a life is emphasized at any cost. So here again, we see the emphasis on both the importance of saving a life as well as the permission to step outside the guidelines of religion in order to preserve human life. Next, we're going to step into areas of direct interaction with Muslim patients. Let's discuss issues related to hygiene. Religiously, cleanliness is heavily emphasized with teachings like cleanliness is a part of your faith. Now, side note, what you'll encounter in terms of cleanliness definitely will be influenced by certain factors like socioeconomic status and even individual culture. But regardless of who's in front of you and what their personal hygiene looks like, there are a few important points that Muslims likely share. We'll start by explaining the difference between something being dirty and something that's considered impure, which has a religious connotation. Dirty can refer to spilled food, dust, dirt, basically things that aren't pleasant but aren't intrinsically impure. Impurities refer to things like urine, fecal matter, semen, or blood. The reason this distinction is critical is because regarding impurities, not only are they dirty, but religiously they also invalidate your prayer and your state of cleanliness. So on this point of hygiene, the emphasis is that if a patient has any of these impurities on them, like on their clothes, their bed sheets, it's not sufficient, for example, to wipe them down. To properly clean these items, remove the physical impurity from the patient's body or clothing altogether, replace the items that contain the impurities, and possibly offer the patient a chance to shower or wash up. And on that note, you might also notice that some Muslim patients wash their bottom with water after using the bathroom, and it's for the same reasons of removing or washing away impurities. Again, this is important for various reasons, including that impurities need to be removed in order for a person to be in a suitable state for prayer. Next, we'll talk specifically about women's health. There's a lot to cover here, so let's get started. There's usually a lot of modesty around the issue of gynecological exams, especially for young ladies and most particularly for women who haven't been married before. For background, religiously, premarital sex is not permitted. Again, that's the religious ruling, but as healthcare workers, you'll see a wide range of situations, of course. But it's important to note that because for many cultures, talking about sexual activity can be considered taboo outside of marriage. It's okay to discuss whatever you need to as a healthcare worker, but if you notice some discomfort or a quickness to say that someone isn't sexually active, that's probably why. Moving on, females who have never been sexually active may decline a gynecological exam, even if it's medically indicated. What we recommend in these situations is an open, clear conversation. A doctor or nurse should explain the risks and benefits as well as alternatives that might exist. Some young women or their parents, on their behalf, might decline some treatments, like the HPV vaccine, because they default to the notion that it's not necessary since the patient isn't sexually active and especially not sexually promiscuous. But staying on this example, it's important to offer education regarding the life saving protection that this vaccine provides and the fact that it's possible to contract HPV even when a patient is being socially and religiously responsible. In general, same sex healthcare worker is often preferred. But we say in general because, again, the Muslim community is not a monolith, as illustrated on this next slide, in which a Muslim female patient said, even in countries where Muslims are the majority population, we have male gynecologists, nurses, and all sorts of male healthcare workers. I understand that some people have a preference, but it doesn't matter to me. So you'll find a variety of preferences, and we'll pause for a moment to remind our viewers that Islam is a global religion with cultural influence from all parts of the world and made up of people with an infinite spectrum of personalities. But when it comes to cultural competency and sensitivity, we'll continue to focus on the general context and more likely instances you'll encounter. Moving along, let's shift the conversation slightly to obstetrics. In this section, we'll talk about contraceptives, abortion, pregnancy, labor, and nursing. From a religious perspective, contraceptives that are permanent, long-term, or irreversible, like tubal ligation, are generally not permitted unless it's medically necessary. That means, for example, that if the life of the mother could be endangered by pregnancy, she can take permanent measures to avoid pregnancy. Reversible contraceptives and using physical barriers are the religiously recommended forms of contraception. Before discussing in which phases of gestation abortion is permitted, it's important to note that embryonic life has sanctity in all phases of development. The conversation around abortion is usually centered around two main phases of gestation: before 120 days and after 120 days. Before 120 days, religious scholars permit abortion in specific situations, including harm to the mother's life, rape or incest, or congenital deformities. However, after 120 days, the fetus is believed to have a soul, and a fetus, in fact, has its own rights in Islam. Abortion is permitted in exceptional cases, most commonly if the mother's life is in danger. To wrap up, we want to point out that regional culture as well as political views will often influence the expression of one's religious values. What does that mean? Well, culture certainly plays a role in religious understanding and scholarship, and so you may find people from certain regions of the world or people who lean in heavily to the culture around them might be influenced by the political or cultural discourse around this issue. At a basic example, women in the West generally exercise a lot more agency around their bodies and their rights. And this isn't meant to offer a religious opinion, it's just the way things tend to be. So, with regards to these sensitive issues, if you, as a healthcare provider, sense that your patient is hesitant and now hopefully understanding some of the religious guidelines that govern that sensitivity, it's often best to advise a patient to consult a religious scholar called an imam about the situation. On pregnancy in general, Muslim female patients are likely to request a female obstetrician. Again, this is likely for purposes of modesty and general comfort. Especially in cases where a woman chooses a female provider, but for whatever reason it's necessary that a male OB should see her, he should be made aware of the concepts of modesty and of issues related to hijab or her religious covering. During delivery, you'll find that women wear their hijab in a way that's comfortable for them. Some women may wear it fully, and while that might be perceived to be uncomfortable given the circumstances, if it's what they prefer, it's fine. Some women might not wear it at all, and other women might request something like a medical hairnet. The point is not to impose our ideas on what's comfortable or not to somebody else. On pregnancy in general, Muslim female patients are likely to request a female obstetrician. Again, this is likely for purposes of modesty and general comfort, especially in cases where a woman chooses a female provider, but for whatever reason it's necessary that a male OB should see her, he should be made aware of the concepts of modesty and of issues related to hijab or her religious covering. During delivery, you'll find that women wear their hijab in a way that's comfortable for them. Some women may wear it fully, and while that might be perceived to be uncomfortable given the circumstance, if that's what they prefer, it's fine. Some women might not wear it at all, and other women might request something like a medical hairnet. The point is not to impose our ideas on what's comfortable or not. Also, unless there's an emergency that requires that you rush into the room, if you can spare a minute, male healthcare providers should knock before entering the delivery room in case a woman who's observing the hijab isn't wearing it at the moment, or if she wants to adjust her clothing during labor. Even during delivery, some women will wear hijab fully or tied back or tied up like a turban, and some women won't wear it at all. And it may seem interesting that she's exposed in very private areas, but still chooses to cover her hair. Ultimately, the point here is that it's her preference and her choice, and it should be respected. One patient we spoke to said, I knew it looked funny. The anesthesiologist was administering my epidural. My whole back and behind were exposed, but I wanted to keep my hijab on. It just made me comfortable, and everyone respected that. Nursing is pretty straightforward. Nursing mothers will require more privacy due to exposure of the breast. And we've mentioned previously, in general, postpartum care, male healthcare workers should not announce themselves and wait for permission before entering a patient room. And although this seems usually to be the case, it's worthy of mentioning that lactation specialists assigned to nursing mothers should be female. That's going to be the general preference. But as is the case with everything we've discussed, you can always feel free to ask directly to see if the patient has any preference regarding gender, hijab, or any other issue. And finally, on this last slide under women's health, we'll address an issue that's come up in various spaces from patients to providers, and that's considerations regarding hijab and vitamin D deficiency in women who cover. Some studies have shown that lack of sun exposure due to modest stress may increase vitamin D deficiency levels. And even though studies are inconclusive, healthcare providers may want to discuss this issue with patients and share alternate ways to compensate, for example, through vitamins or through deliberate sun exposure. And on that note, some patients might think that sitting in front of a window is an easy solution, but glass blocks UVB rays, which increase vitamin D levels, but it doesn't block UVA radiation, which is harmful to the skin. So specific education about healthy options is key. And that concludes the section dedicated to women's health. From here, we'll shift gears to the world of psychiatry and mental health. Psychiatry is such a critical area in general, and the most important thing to note here is that in general, many parts of the world still have a lot of catching up to do in recognizing mental illness as an equally valid concern as physical illness. This is largely because of the cultural stigmas associated with psychiatry and mental illnesses. And in the next slides, we'll cover some of these issues, as well as therapy and medication and suicide. Cultural stigma on mental illness is international. It exists across the globe. And even though things have improved greatly here in the US, that stigma or prejudice is still very tangible here at home. The American Psychiatric Association states that more than half of people with mental illness don't receive help for their disorders, or they avoid or delay seeking treatment. Often it's because of concerns of being treated differently or fear of prejudice and discrimination. In some cultures of the world, mental illness is viewed as disgraceful and a shame to the family. While there are some shifts in perception of mental health and the attention it deserves, there's still a lot to overcome. So as healthcare providers, it's important to recognize some key things regarding diagnosing and therapy. Even discussing mental health can be considered a taboo and might quickly be shut down by the patient or their family. Mental health misconceptions include the idea that struggling with mental health is a sign of weak faith, and even that mental illness is a Western phenomenon. So when you move on with the patient to discuss therapy and medication, there may be resistance to non-religious intervention, such as therapy and medicine. Encourage patients to seek mental health care the same way they would seek medical care for a physical ailment. It's probably really frustrating to diagnose a patient with a mental health illness, and to have a plan of therapy and medication, and then to face resistance. But one of the best things to do in these cases is to help the patient understand that mental health issues are caused by physiological and hormonal imbalances that are often out of their control, the same way that these issues might affect their physical health. Being patient in these discussions and understanding the very strong and detrimental cultural stigma associated with mental health issues can help. But ultimately, drawing parallels between mental and physical health helps the most. Finally, consider incorporating a referral to a Muslim mental health counselor or a Muslim chaplain if available. Sometimes speaking to someone who shares a cultural understanding can help move the conversation forward. Next, we'll touch briefly on suicide. Suicide is a hard topic to discuss for anyone of any faith or no faith. In Islam, life is considered a sacred gift from God. As such, suicide is categorically forbidden, and this is stated very clearly in the Quran. Things that are forbidden in Islam are generally also subject to punishment in the afterlife, unless God Almighty forgives one's sins. Because the teachings against suicide are so clear, some patients with suicidal ideation might experience complex challenges navigating both psychological and religious realms. If you're facing a situation like this, we recommend referring the patient to a Muslim mental health counselor or Muslim chaplain if available. Reading more about this issue is also critical. On our resource page, we've included an article from JAMA Psychiatry titled Suicide Attempts of Muslims Compared with Other Religious Groups in the U.S., co-authored by Dr. Rania Awad, one of the leading American Muslim mental health experts and director of the Muslim Mental Health and Islamic Psychology Lab at Stanford School of Medicine. Her social media links are also included in the resource guide. Transfusions and transplants. Life is very valuable in Islam. To save a life, medical workers should do whatever is necessary in emergency situations if it does not violate the patient's wishes. Both blood transfusions and organ transplants are generally acceptable. This is really straightforward, but there are a couple of questions around blood transfusions and organ transplants that often come up within Muslim circles, and basically, just know that blood transfusions and organ transplants are permitted from any person, regardless of their faith background. And that if you do have a patient or a family member who's hesitant to receive either of these for any reason, just encourage them to speak to a religious authority for clarification. Organ donation is slightly different. There are various religious opinions around organ donation. Some jurisprudence allows it, others have conditions around it, and still others consider it not permissible. Most people who sign up as organ donors would have done their own religious research first, but some people might not have considered it at all. And the key point here is that healthcare workers can suggest that a patient donate their organs, but stay sensitive to the different opinions regarding the permissibility, so keep it at that, just a suggestion, and let the patient navigate it based on their religious leaning and comfort. On behalf of CAIR-Florida and the Hospice and Palliative Nurses Foundation, thank you very much for joining us.